Doctor, you were telling us about hypercarbia? Yes, hypercarbia, or CO2, retention in respiratory acidosis and metabolic alkalosis. What about metabolic alkalosis? Well, that means a decrease in the hypocarbia. Is there an excessive loss of carbon dioxide? Yes, but only in hyperventilation due to respiratory alkalosis or metabolic acidosis. What is the pH, doctor? The pH is the hydrogen ion concentration or acidity value of blood or urine. And are there such things as normal values? Yes, there are. For instance, for the arterial pH, yes, 7.37 to 7.44. And the venous pH, yes, 7.35 to 7.45. And will that result in what? It will result in an increase in acidosis and a decrease in alkalosis. Doctor, what is PO2? PO2, or potassium, is the pressure or tension of oxygen expressed in millimeters of mercury. And are there normal values? There are. What is the normal value of arterial PO2? It is 80 to 90 millimeters. And venous PO2? Venous PO2 is 25 to 40 millimeters. Patients with chronic lung disease may normally have an arterial PO2 of 70 millimeters or less. And are there decreased values? Yes, there are, in the arterial PO2 in advanced lung or heart disease. What about venous PO2? Yes, venous PO2, due to inadequate blood volume, exchange of gases, cardiac output, and tissue perfusion. Doctor, what is a fibrindex? A fibrindex is a rapid semi-quantitative test for fibrinogen using thrombin. And the normal fibrinogen index is what? That is the method of Bond and Sweeney. And is it after 5 to 10 seconds? Yes, then you have the beginning clot formation. What is the subnormal fibrinogen? That index is after 60 seconds. It is resulting in an absence of firm clot or minimal gel formation. And, doctor, the fibrinogen determination is what? Well, that is a test which measures the concentration of fibrinogen in the blood plasma. What is the normal value, doctor? Circulating fibrinogen in plasma, it is 0.2 to 0.4. And is there a decrease in some blood diseases, doctor? Yes, nutritional deficiency and liver damage. What about the serum iron determination? That is a test which measures the serum concentration of iron. And is there a normal value? There is. It is the method of Barkan and Walker. And is it a serum iron level? Yes, 50 to 150 micrograms per 100 milliliters. Doctor, related to hematology are certain abbreviations. That is correct, such as ACD, which is acid citrate dextrose. What about AHF? AHF is anti-hemophilic factor 8. And AHG? AHG is anti-hemophilic globulin factor 8. And CBC, that is complete blood count. And ITP is idiopathic thrombocytopenic purpura. What about the corpuscular hemoglobin? That is MCH. And what is PMN? PMN is polymorphonuclear neutrophils. Doctor, let me ask you about the American Association of Blood Banks. Yes, the AABB. And is there also an ASCP? Yes, the American Society of Clinical Pathologists. This peculiar and interesting disease, that is Hodgkin's disease, is characterized by a painless enlargement of the lymph nodes, which is initially confined to one group, frequently those located in the cervical region.
Speaking of that.
We just finished that tape.